Morning and welcome to Flashpoint. I'm David Coty. I'm here on every Friday, beginning from 10:30 to 11:30 for the program Flashpoint. And I'm here today with two medical practitioners, as usual. They are here from the Jahmele Medical Solutions, and they're going to be telling you about a major topic today called fluoroscopy. They are Dr. Tishali Wubet, a radiologist. Welcome to Flashpoint, sir.
Thank you.
Thank you. And Mr. Adrian Jackson, a radiographer. Welcome to Flashpoint.
Thank you very much.
Thank you. And for the public, we are also on Facebook, the David Coty page. We're at 6.5K now. And I hope those of you are following all over the country. I'm proud of this administration. We're all over the country now, ELBC. And if you follow me somewhere there in Bokonjali, on Lofa, in Pasadena, please go to the Facebook page also and watch. Just put a David Coty. It's not Cotie, it's Kortie, David Coty. And this program is going to be uploaded on YouTube in a few hours from now. But right now we're live on Facebook, the David Coty page. And within a few hours, we're going to be uploaded on YouTube. So please follow me. I want to say many thanks to those of you who follow all the time, especially Mr. Conrad Bajwa, a very good friend of mine who does not miss this program. He follows all the time, especially when he comes from the States. He's always tuned to this program. Conrad Bajwa, wherever you are, good morning. Now, we don't have much time, so let's go straight into the issue. Dr. Tishila Wubet is a radiologist, and I'd like you to introduce yourself just for a few seconds.
Okay, thank you so much for having me.
Yeah.
My name is Dr. Jahmele Wubet.
Yeah.
I'm a radiologist in Jahmele Medical Solutions and head of the imaging unit.
Oh, head of the imaging unit.
Yes.
Yeah, so. Okay, Mr. Jackson.
Yeah, thank you, Mr. Coty.
Yeah.
My name is Adrian Jackson,
Mm-hmm.
and I'm a radiographer. I also work with the imaging unit at Jahmele Medical Solutions.
Okay. Who is a radiographer? Tell us about it.
Yeah, basically, a radiographer is an imaging or medical imaging personnel. A function basically in the area of image acquisition, that is image production.
Okay.
So we carry out the manipulations using the machines to produce the image.
Okay.
Thank you.
How does that differ from your title? You are a radiologist, radiographer. How is it different from yours?
Okay, so basically a radiologist is a doctor who specializes in radiology and is responsible for interpreting the images that are done by the radiographer.
Oh, I see.
The procedures,
So you
all
work
in-
hand in
Work
hand.
together.
Yes.
Oh, you work together.
Yes.
That's good. Okay, our topic today is fluoroscopy. Now, I want you, the public, please explain to the public what fluoroscopy is all about.
Okay, I'm quite excited to explain today about fluoroscopy.
Yeah.
Quite special imaging equipment in Jahmele Medical Solutions called digital fluoroscopy. So, well, for everyone wondering what fluoroscopy is a live image of an X-ray. Okay.
Okay.
So, an X-ray, you can think of it as like a snapshot, a single image or a still image. But fluoroscopy is a real-time image of an X-ray, which means you can think of as a live video of the body.
Aha.
Okay?
I like that. Very
A
simple.
live video of the body,
Yeah.
which means it enables us to see, for example, how our organs are functioning. Okay?
Very strange.
Yes. So it differs from X-ray by this.
Okay.
Okay.
Okay. In other words, the fluoroscopy is different from just an image, a picture you're looking at.
Yes.
This one is like a video.
A
The
video.
doctor is looking inside you and everything is moving in there. He's looking at everything moving in you.
Perfectly.
Ah, that sounds good. What would you like to add to that, sir?
Yeah, like what Dr. Wubet said, fluoroscopy, that has to do with obtaining images of our body structures, organs that are in motion.
Emotion.
In
You
motion.
remind me of an action TV. Way back, we used to have something like here at ELBC called Action TV. You're looking at the people moving, everything is moving. So if you are
Yes.
doing mind brain, you're going to be looking at everything in the brain that moving. If you're doing the heart,
Heart.
everything you're looking at it moving.
Yes, moving motion.
Then my next question to you, Dr. Wubet.
Yes, sir.
You are the doctor. You're going to have a screen before you, looking at everything in motion. I am the patient lying down there. Will I be able to see my own heart too moving and my own brain moving? Is it possible?
Okay, it's possible actually. Okay, so when we do the procedure, we have two control spots.
Okay.
One control spot, which is a screen to see the live video, is in front of the person who does the procedure,
Yeah.
and another is outside. So it's possible a patient can see their image moving in front of them while we do the procedure.
Yeah. Does it not scare me, the patient? You are the doctor. You are trained to that. It will not scare you. That's your job. You're trained to it. But I am looking at everything. Would I not be afraid to see that?
Well, it's not actually. There is nothing to fear about. It's a very simple procedure. Most of the procedures are very simple procedures, and they don't take much time. Okay. So, but before that, we actually explain everything about every procedure, about every step to our clients.
To the client.
Yes.
Okay. The next question is there any side effect, the radiation, any problem that will harm me later on when I get through that process? Any problem?
Okay, good. So, digital fluoroscopy actually uses the lowest radiation dose. The lowest radiation dose that's almost comparable to daily environmental background radiation. Okay? So there is no actually worry about the radiation dose because of one, the equipment itself uses the lowest radiation dose. It's very state of the art, standard, world class. And the other is we have also protective equipments. Okay? So we don't unnecessarily expose a body part which is not the target for the image.
Protective equipment.
Yes.
To protect the human body. All right.
Yes. So we use these mechanisms. Okay.
Mr. Jackson.
Yeah.
Jahmele has professional equipment.
Okay.
And also the expertise to handle them.
Yeah.
I know that you have the CT scan, and I know that you have the MRI, and now you have the fluoroscopy.
Yeah.
All of these things are with you there. If I'm not mistaken, you are the only one in this country with those things. Why did you bring in a fluoroscopy when you already have the MRI and the CT scan that can do? It does the same job, right? Why do you have to bring in a fluoroscopy when you already have MRI and CT scan? Tell me the difference.
Yeah. So there are differences between each of these imaging modalities we are talking about, and each work best based on what we are trying to look for.
Okay.
What we want to diagnose. Okay. So now there are certain conditions using the fluoroscopy is better as compared to using others.
Okay.
Yeah. So there are several differences. Let me talk about the fluoroscopy and the CT scan. What are the differences between them?
Right.
Now, like we said earlier, fluoroscopy, we are able to get images in motion, like a live video.
Yes.
Or also say dynamic images, real-time images. Okay. So with this, we are able to monitor structure as well as function. Okay. Yes, structure as well as function. Yes. Now, so based on certain things we want to diagnose or what we want to check for, fluoroscopy is best. We are able to monitor how the organs are moving and things like that. But for CT scan, we are able to generate what we call 3D images. Okay, 3D images, and they are in slices. Okay, so CT scan basically work best for anatomical assessment. So we're able to check the structures and things. So it is quite different from what the fluoroscopy does. And then another imaging modality we have is the MRI. MRI also different from the fluoroscopy. So for MRI uses radio waves and magnetic field to generate images. Okay. And then for the fluoroscopy, it uses X-ray. So that is a difference between it. And also, MRI can be used to visualize tissues. Yeah, best tissues. Okay.
Okay.
Yeah, so
Okay.
these are some of the differences,
The differences.
between fluoroscopy and the other modalities.
Dr. Wubet.
Okay, so let me add something
Okay.
to
You can
what
add.
Adrian
Yeah.
said.
Mhm.
So every imaging modality, imaging equipment has strengths, okay, and some weakness. One may be stronger to image one body part, and the other may be weaker. So they are not replaceable, but they are complementary. Okay,
Oh, they are complementary.
yes, we complement with the other. For example, I have to mention two things here. When we come into fluoroscopy, fluoroscopy, for example, is best more than any imaging tool in the world.
In the world.
In the world, I can say to study two things. For
Yes.
example, when we come to fallopian tubes or the genital tract, the female genital tract, to image the fallopian tubes, fluoroscopy comes as a gold standard.
Okay. Even
Yeah.
the fallopian tube through which
Yes.
the egg passes.
Definitely, yes. It's a
Oh.
tube where the egg passes
Yeah.
from the ovaries through the tube into the uterus.
Right.
So
That will cause pregnancy.
yes,
All right.
and then pregnancy. And when there is a problem in either of the fallopian tubes, on the right or on the left,
Yeah.
when there is a blockage, for example, infertility comes. So as a workup, as a diagnostic tool for workup test for infertility, fluoroscopy comes as a gold standard. It is not even replaced by MRI, CT scan, or any other modality in the world. Okay, so these are the strengths and the weakness.
Yes. And so, in other words, we Liberians should be very proud that we have a fluoroscopy in Liberia.
Definitely.
Because that will prevent people from traveling to Ghana, South Africa, and India
Definitely.
for treatment. So patients, people who are listening to us now, and to these sound medical practitioners, if you have to go to Accra, Ghana, or India or Ghana, it will cost you transportation,
Definitely.
plane fare.
Yeah.
You have to look for somebody to even travel with you when you're going. Too much money. And besides that, the security in there. Most people are afraid to ride plane, including me. Like I boastfully said here before, I have traveled to 17 countries, but I have never been used to airplane. I'm always afraid. When I'm in the air, I want to come down.
Okay.
Because it's not safe. So Jahmele is telling you, they stop all of that now. You don't have to go to Ghana or any other place. Stay right here and do your everything. That's good. Are you very expensive? That's not for you to answer. You're not in the financial area.
Yes.
Okay. We'll give you numbers later on, and you will call those numbers, the office, and they will tell you how it goes. But from my own understanding, I understand that it's very reasonable here. Very reasonable. So we're going to give you numbers later on that you're going to get to call the office that will give you charges or prices of the CT scan, the MRI, and even the fluoroscopy. All right. Now, what are some of those? Before I ask what the illnesses you look for, if I want to check my entire body, I just want to go to do fluoroscopy. You just check my whole body from head to toe. Is that possible?
Okay, so let me go for this first.
Yeah.
Fluoroscopy actually is not designed to that. Okay.
Okay.
Yes, but there are machines who can image entire body, but the purpose depends. Okay, so the purpose of fluoroscopy actually is not designed for that. Okay, so it actually rather helps us see part by part,
portion by portion,
like or adjacent parts of the body.
Part of the body.
Yes, let me put one example here.
Yeah, go ahead.
So we can see, for example, we can image the esophagus and the stomach and part of the small intestine at the same time.
Okay, now let's get that clear. Yeah. You can check the esophagus.
Yes.
That's the pipe through which food passes.
Yes.
To go to the stomach. You can check that and what at the same time?
Yes, at the same time.
Which one? The esophagus and what?
Okay.
In the stomach?
Esophagus, the stomach?
Yeah.
Esophagus.
Yeah.
The stomach.
Yeah.
And the small intestine.
The small
part
intestine.
of the small intestine.
That's big news.
Okay. Yes.
Okay, if you can check those three at the same time,
yes,
that's big news. You know, some people are confused about this whole thing. They think that you're going to lie down there and you just start to see the brain, the stomach, the everything all the way down there. No, it's not designed for that.
It's not designed
but
for
it
that.
does everything part by part.
Definitely.
If you want to do your brain, they will do that for you. Mr. Jackson,
Yeah.
what are some of those illnesses you check for when you're doing the fluoroscopy?
Yes.
But before you answer that, the program you're following is Flashpoint, and I'm David Cote. We are here on ELBC every Friday from 10:30 to 11:30, talking about health. Sometimes I bring in politicians. I got to pay my bills here. It used to only be health, 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 but now I have to include some politicians to help me pay my bills here. But medical people come most of the time, like you see now. Answer your question.
Yeah, so there are several conditions we can diagnose using the fluoroscopy. For example, conditions affecting the esophagus can be diagnosed using the fluoroscopy. There are some people experiencing difficulty swallowing. Okay, so is it due to a mass causing it? Is there an obstruction? So using the fluoroscopy, we can visualize the esophagus. So if there is any abnormality, we will be able to see it, can visualize it. Besides that, there are people having infertility issues, like what Dr. Tishali said, where the fallopian tube is blocked. Okay, using the
Please explain
fluoroscopy.
infertility. When you are unable to get pregnant.
Yes, unable to get pregnant.
You know, we have different people who follow this program always.
Yes, yes.
We have the big book people, and we have the blackhead women, and
Of course.
and the old man down there. Yeah, yeah. So
Of course.
infertility
Yes.
is the inability to
So
conceive.
that, yes,
You
people
can't-
are
you
finding
can't
it
get
difficult. Yes,
Even
can't get
as a
pregnant.
man, you know, people think that infertility is only in women.
Oh no.
There's infertility also in men.
Yes.
There are some men that are not able to impregnate women because of certain reasons.
Yeah, yeah.
You will
sure.
be able to identify the reason.
Yeah, sure. Yeah, so for what I'm talking about is about the female. They have
Oh,
fallopian tubes.
Okay.
Yeah. So where there is a blockage, meaning egg will not be able to move down to the uterus.
Yeah.
Okay. So using the fluoroscopy machine, we are able to visualize the fallopian tubes.
Okay.
If there is a blockage, we can see that.
Yeah.
Okay. Besides that, there are some men that experience urinary retention and things like that. At times, it is due to a stricture or let's say a blockage within the urethra where the urine passes from the bladder outside.
Okay.
So if there is a blockage, we can use the fluoroscopy machine to visualize the urethra, and we are going to identify the issue there. Yes. Besides that, there are some issues with our intestine, the colon or the small intestine.
Yeah.
Using the fluoroscopy machine, we can also visualize that. Okay, so there are several other conditions,
That you can
but
find.
basically these are the common ones, you know,
Okay.
I use to
Would you like to add to
diagnose
that,
using
Doc?
the fluoroscopy.
I like that.
Okay.
Thank you. Please add to that.
Yes. Okay. So we can like image the digestive tract. Okay, from esophagus to
digestive
rectum.
tract.
Yes.
Okay.
Especially fluoroscopy is important in the following parts: the digestive tract,
Yeah.
the genital tract, the uterus, fallopian tubes, ovaries,
Yeah.
and the urinary tract. Okay, so the urethra, the bladder, the kidneys, and the ureters
My goodness.
in the body. Usually, the tubular parts of the body are best imaged by fluoroscopy than by other modality.
So you're saying that it is better done by the fluoroscopy than any other thing,
Definitely.
any other machine.
Yes.
Okay. That sounds good. Okay. What about confidentiality? You know, I trust you medical doctors. I'm not a doctor, but I know you. I trust you. And I just have a feeling that the first course that medical doctors learn in school is confidentiality. I just believe that way. This is why I always say to some people, don't be afraid of doctors. They are not cheche police. They are not bizabades. You know, in Liberia, when we say cheche police, somebody who likes to talk about other people's problems. So doctors are not cheche police. They went for training for that. Let's talk about confidentiality. I have come to you to do my fluoroscopy, and you have checked me, and you see something moving to where it is not supposed to be. Can you go and tell somebody, oh, that guy who just left from here is having this problem? Should I be afraid of you because of you not being able to be confidential?
Okay. Let me say something about this. We as medical professionals actually have oaths when we graduate from medical schools. Okay, so we have ethical considerations and took oaths to keep confidentiality of the patient. And Jahmele particularly follows a strict confidentiality and ethical consideration about our clients. Okay, so it's only between the patient and the professional.
Okay.
So no worries about this.
No worry about that.
Yeah.
In other words, you do not only have the professional equipment, but you have the expertise who are able to keep your secrets. You can keep my secrets.
Definitely.
Definitely.
Yes.
What do you want to say? Because we've got about 10 minutes to 11 o'clock. At 11, we're going to be opening the lines for people to call to ask you some questions.
Okay.
Take the 10 minutes now to talk about what I didn't ask you. Maybe something you want to say about the fluoroscopy that I didn't ask you. What would you like to say about this machine, this modern machine that Jahmele is the only one that has it in this country?
Okay.
Yeah, go ahead.
I would like to say something. Okay.
Yeah.
So digital fluoroscopy. This digital fluoroscopy actually is the first of its kind in Liberia. Okay, it's the first of its kind and very state of the art. So when it comes to, we mentioned about radiation before. When it comes to radiation, Jahmele actually follows top priority, gives top priority to safety standards. So this machine, we follow international safety standards. Okay, there are safety standards criteria put according to International Atomic Agency, International Atomic Energy Agency.
Yeah.
So we strictly follow and check and maintain our machine based on this criteria. So to make emphasis on the safety of radiation. So this makes our fluoroscopy very special and quite different.
That's a good information. Yeah. What would you like to say that we didn't ask you?
Well, I would like to talk about some of the advantages using a digital fluoroscopy has over a conventional one, right? Sometimes.
And what you have is a digital.
Yes, it's the digital.
That sounds good.
It's the digital. Yeah. Sometimes.
You know, one thing I noticed about Jahmele, you don't do small things. CT scan, you had it before other people started talking about it. MRI, I think right now you are still the only one with the MRI in the whole country. Yeah. Now you have brought another thing that nobody has here. Come on, go ahead.
Yeah. So the regular X-ray, the conventional X-ray, can sometimes be used to diagnose, conditions that should be used by the actual fluoroscopy machine. So we call that blind fluoroscopy.
I like that.
Yes, blind fluoroscopy.
Obviously.
Now, there are lots of advantages using the digital fluoroscopy.
Go ahead, sir.
Comparing it to the blind.
The blind, yeah.
Now, number one, that the teacher talk about safety. The digital fluoroscopy is made in such a way that minimal radiation dose can be used, meaning you are safe. No need to worry.
No need to worry.
Okay, yes, that is one. Number two, using a blind fluoroscopy is like we are emitting radiation, but we are not seeing. Unlike the digital fluoroscopy, is like a live video. Yeah. So we are able to visualize organs as, the function. Yeah, unlike the conventional or the blind fluoroscopy.
Yeah.
So one thing that comes about using the blind fluoroscopy, there are high possibility of being exposed to a high amount of radiation. Yes, because the person doing the examination is not seeing, so more radiation will be emitted.
I see.
Unlike the digital, we are seeing, so there is no need for a lot of exposure and those kind of things.
Okay.
Yes, so the patient is safe, right? Besides that, we have something called post image processing. Okay, so with the digital fluoroscopy, we are able to further process images acquired to have the very best quality that is going to aid a precise diagnosis, precision. Okay, yes. So we are going to get exactly what the issue is.
Okay.
Exactly what the issue is, because we can adjust the brightness of the image and all that with that. The picture is going to be crystal clear. No problem, no difficulty. We're able to see exactly what we are looking for.
Yeah.
Unlike the blind fluoroscopy, like you cannot do post image processing. So with that, there's a high possibility that the image quality is not going to be good.
No.
And once
with
image
design.
quality is bad, definitely it is going to affect having a precise diagnosis.
Right.
So that is one big advantage the digital fluoroscopy has over the blind or thing they do. Okay. Yes. And another advantage is like we are able to visualize function.
Yes.
Right, using the digital fluoroscopy.
You see what's happening in there.
Yes, you are able to see what's happening.
It's moving right inside.
Yes, you are able to see just
everything,
beating everything. Another thing, for example, you are able to visualize peristalsis. That is, if you are swallowing something as it goes down, you are able to visualize it.
Look at that.
You are able to visualize it. Unlike the blind fluoroscopy, you are not seeing. You are not able to see.
If I make a request to you,
yes,
as medical doctors, I said, now I have done my fluoroscopy here today.
Yeah.
Can you give me the recording so that I get home and see everything you've been watching? Is it possible?
Okay, let me say something about this.
Yeah.
So it's actually additional to him. So when we say digital, which means the images are processed instantly. Okay.
Yeah.
Images are processed instantly, stored, and they can be shared. Okay. So the live video of your image can actually be shared. That's the difference between digital fluoroscopy and what he said, blind fluoroscopy. Yes. So the other thing is quality.
Liberia is blessed. We are blessed.
Definitely.
Yeah.
Because we have never heard about fluoroscopy here before, except for about 3 or 4 months ago when you invited some of us to go there to see it and to see how it works. And I saw everything you're talking about. You were the one demonstrating there, and we saw how it works. So Liberia is blessed. Thank God for Jahmele in the first place. Okay, now the program is Flashpoint, and we'll soon be taking a break. And when we take the break, we want you to be a part of this program by calling 0777 511 977 or 0886 511 977 to participate. Ask them any questions about what we're saying here. They're going to be able to answer you. One of the main things I want you to be concerned about is this issue about travel. We have always said it here. When Dr. Tara Warrior came over, we talked about it. You're going to be safe from spending thousands of dollars to travel to other countries to do this thing that can be done right here. They have to train people here, and like you heard them say, this is a state of the art. It's not just any fear momo thing. No, it's a correct one. So we will take a short break by playing our theme song, and when we come back, be a part by calling 0777 511 977 or 0886 511 977. They're going to be ready to answer you. Let's take a break.